welcome to part 1 of hip mobility. I have today with me a special guest.
Hi guys, I'm Dr. K. I'm a local sports and dance physical therapist located at Life Clinic Physical Therapy and Chiropractic in Plymouth, Minnesota. Thanks for being here. Today we are going to talk about hip techniques with the mobility strap. Joint mobilizations and capsular stretches have long been used by physiotherapists and physical therapists as treatment techniques. After we determine if there's a joint dysfunction, directional bias, or limited joint mobility. This is a common one that is used. Capsular stretches with a mobility strap have recently become very trendy in dance and fitness training. Before jumping on that bandwagon, you need to ask yourself as an instructor or as a participant, do I know what a joint capsule is and what is its role in my joint health? Do I know which direction my joint capsule is restricted? What are the contraindications to capsular stretches? I will give you a hint. Hypermobility, meaning anything beyond normal human flexibility, is a relative contraindication. If you can't answer these questions for yourself or the students in your class, choosing to do capsular stretches may be out of your scope of practice, and you may be putting the hips at risk for potential injury, or shoulders, or whatever joint that you're choosing to use the strap for. Rather than a tight hip joint capsule, dancers much more commonly have hip capsular and ligamentous laxity. This increase in laxity in the joint capsule and ligaments causes a little bit of instability in the hip, or a micro instability. That can actually lead to an injury and increased muscle tightness. Whenever the body senses instability, your muscles are going to grip in order to have stability. That's its compensation. So don't mistake muscle tightness for capsular tightness.
So instead of using the mobility strap for capsular stretches, we are using it for proprioception to increase the stability and support for dynamic, beautiful movements in dance. We're doing the hip suck. So again, the belt is tractioning my leg, and I'm thinking about my hip sucking back into the socket. I'm using those deep fibers of my psoas and releasing. And again, it's sucking the hip back into the socket, approximating the joint, putting it in a better place to work with dynamic support.
So thanks for tuning in. Stay tuned for part 2 of hip mobility with Dr. Misty, and I will look at multi-joint static stretches for the hip.